Today we're going to look at some rear-facing car seat installation challenges and some of the things that may be more challenging for parents and caregivers when installing and harnessing children in car seats. This seat, for instance, this is a base for a rear-facing infant-only seat. And upon first inspection of the seat, I notice that it's locked down using the seat belt. However, once I remove the seat belt and get a better look at the seat, I can see that the parent or caregiver has also chosen to use the lower anchor connectors in unison with the seat belt. And although using the seat belt or the lower anchors is generally a choice and each are equally safe, the manufacturer of this car seat issues specific instructions not to use them both together. And that's also the case with most seats out there. And remember, we always want to follow the manufacturer's recommendations for installation, harnessing, and general use of a car seat, because they're the ones that designed, engineered, built, and above all, crash tested that seat to meet all existing federal motor vehicle safety standards.
I would say one of the biggest rear-facing car seat installation challenges I've come across is working with families that are doing an installation for a base for a rear-facing only car seat, and over-tightening the base to the point where it lifts off the vehicle seat. So it's educating parents to let them know that tightening the car seat so tight isn't always the safest.
One of the most common errors that I come across with rear-facing car seat installations is an incorrect recline level. Many caregivers do not realize that there may be a recline foot on their infant car seat base, and when they finish the installation, most of my caregivers are first-time parents and they don't actually have a child in the seat yet, so they're not really seeing what it's doing. So oftentimes this results in the car seat not being quite reclined enough. I've also seen caregivers use some very inventive things to help adjust the recline if they don't realize that there's a recline foot there, such as blocks of wood.
Sometimes one of the hardest things about installing a rear-facing car seat is just getting your hand through this belt path in order to thread the seat belt or the latch strap. It's frequently a small opening and it's hard to push it all the way through. So a good tip, and something that's frequently mentioned in the owner's manuals, is to just pull the front of the pad away to expose the belt path. And that way you can bring your hand inside and then help the belt go through the belt path to do the installation. Another advantage to this is it really exposes where that buckle strap of the harness system is, so you can be sure that your installation strap is not getting in the way of it, so that when you put your pad back together, you can see that the harness system is still working properly. You want to check the instructions as well to make sure that, depending on where your buckle strap is located on the seat, is according to the child's needs, and also that your strap is going properly in front of or behind it.
Another common issue we see with rear-facing infant-only seats, as far as the installation inside a vehicle goes, is the carry handle. The carry handle of the seat is designed and built primarily for carrying the child when outside of the vehicle. We always want to check the manufacturer's instructions as to the angle that this handle needs to be set in for travel in a vehicle. For instance, this has the totally upright angle for carrying. It has a secondary storage port here, or it can be stored fully. In the manufacturer's instructions for this seat, it specifically recommends that we do not travel in the vehicle with the handle in this position. And remember, we always want to follow the manufacturer's recommendations.